Welcome to the Fix Your Sciatica podcast, where we meet with experts and clients and discuss how to manage your sciatica and low back pain without the use of medications or surgery. I'm your host, Dr. Ashley Mack, and I'm a physical therapist as well as the founder of ifixyoursciatica.com, a go-to resource for pain management. So let's talk about dry needling. What is it? How can it be helpful? And why is there so much misinformation about it? And today's guest, I have Dr. Dustin Buck, who is a physical therapist, but also the head of a major education company that actually educates other physical therapists on the various different aspects of manual therapy. But I got connected with Dr. Buck and was really interested in his knowledge about dry needling. And so he was kind enough to share his knowledge for today. So we can share that with you so that you know what to look for and some key action steps when it looks for finding a practitioner and how you can actually take another step further in your sciatica pain relief. So Dr. Buck, thank you so much for being on today's episode.
Thanks for having me. Appreciate it.
The pleasure is all mine. I'm really glad that you are taking the time out of your day. I know that we were experiencing some technical difficulties earlier this week, and that was a challenge in itself. And so let's get right into it. Let's talk about you and your experience. How did you get to where you're at today, just so that the listeners can get to know you a little bit better?
Yeah, well, I graduated physical therapy school back in 2010, so been a while now. And then I did a manual therapy fellowship in 2015, I believe it was. And then after that, I finished my OCS, orthopedic certification. And just kind of grew from the start of that manual therapy fellowship. I had only barely heard about dry needling when I was in physical therapy school. And so that was just something on the fringe as far as I was concerned at that time. And it wasn't until later that I was like, oh, this is pretty cool. I can actually get into where the pain is. And so that's what really attracted me at first, was just that I could actually get in there to where a patient was having pain and have an effect internally. So, yeah, that's kind of where that blossomed from. And then during that manual therapy fellowship, I had a chance to help out with some of their classes and decided, I'd like to kind of do this on my own and develop my own curriculum and try to bring things together that I think right now are just kind of pretty separated by different occupations as far as needling goes.
Yeah, what a cool journey you've been through. I think the big principle that I've noticed amongst people who have their say certification in manual therapy, like focus on manual therapy and gone through the manual therapy fellowship, was this thought process of diagnosis and treatment. And what I really appreciated about the manual therapy aspect was being able to say, let me collect this necessary information, come up with a specific hypothesis or a decision, and then let me go ahead and test it. And then from there, based on those results, we can actually conclude or not conclude what the issues are. And so to me, from my end, it sounded like it was more of a dynamic aspect of being able to say, okay, you have these tools, but also how do you use these tools? And dry needling itself is a tool and a modality within itself. And I've discussed this over the past couple episodes where it is important for us to work with practitioners who have wide knowledge of the various different tools that are out there, but it's also important for them to understand when it is the right time, the right place to actually use these tools. So rather than having a hammer and thinking everything is a nail, being able to look in your toolbox and use a specific tool that's necessary for the problem based on the information that you're getting. And so let's talk about dry needling itself. A lot of people think, is it acupuncture? What is it? Like, if you could describe to us what dry needling is and how is it different from acupuncture?
Well, it's a pretty nuanced sort of answer, and it kind of depends on who you talk to. But I mean, the basics of it are, you're using that thin filiform needle to penetrate the skin and have an effect on the underlying tissues below that. Where things, differ as far as practitioner background and such is how we define what dry needling is. For some, it's just all about the muscle tissue. Trigger points have been something that the rehab world has focused on for a long time, and so that's kind of where physical therapists have kind of anchored themselves in to some degree, and sometimes maybe a little bit too much into that area of trigger points. That is an important part of the pain picture, but there's certainly other areas where we can treat that don't involve using trigger point sort of thing. And then you got the acupuncture, which, depending on your background, could mean practicing it in a traditional Chinese medicine sort of way. But then medical doctors do it too, and they don't treat with that approach of Chinese medicine. And then you have a lot of people that are kind of in between, because even acupuncturists that are trained in a Chinese medicine sort of background, they learn anatomy, they learn about circulatory processes, but they don't focus on it as much as your allied healthcare profession. So you've got kind of this mixed bag of, people on one hand saying this is all acupuncture, and then other people on the other hand saying, well, no, this is dry needling. It's completely separate from acupuncture. But the real truth of it is it's all, and a lot of it is overlapping. From my standpoint, what I think is an accurate answer, the most accurate answer when it comes to this question, is that dry needling, and no, I'll take a step back even further than that. The main reason that we have to have it be different between these professions is, as physical therapists in particular, we can't call it acupuncture. They have control over that word. But that word only means needle insertion. And so other countries, Great Britain, Australia, probably many others, a physiotherapist can call it acupuncture. They just call it medical acupuncture. So in the States, though, we have to play this sort of dance of legality. And so we can only call it dry needling. Fine, whatever. I'm fine with that, but there's certainly overlap between what we're doing and what the acupuncturists are doing. But to come back to my statement about how I would define the difference is, and when I talk to patients about it, this is what I say. I say what I'm going to be doing is using the same needles, put them into your body according to the body's anatomy and based off of scientific theories and approaches. I'm going to be talking to you about blood flow and the body's pain-killing systems, endorphins, things that can be tested scientifically. Whereas somebody trained as a purist in the acupuncture Chinese medicine approach is going to be talking to you about liver yi, yang, qi, meridians, and making a diagnosis based off of a complex set of Eastern medicine-based concepts. So that's, to me, the primary difference. And then when it comes down to the real nitty-gritty of what does that mean as far as what the treatment looks like, to me, it's about, for me as a dry needling musculoskeletal practitioner, I treat only neuromusculoskeletal conditions, pain, stiffness, and I put those needles into the usually more localized, based off of where the symptoms are, and then maybe some needles that correspond to nerve distributions. Whereas an acupuncturist trained in the Chinese medicine approach might put in 30 needles in all over the body based off of their Chinese meridian system. So that does help patients. I don't give them this much information, but I will tell patients that last part, about the science part of it versus Chinese medicine approach, and then where the needles go. But there's a lot of overlap in there too. So I hope that helps. There was a lot of information, but it is a very nuanced sort of thing.
We are going to take a quick break to tell you about our awesome new program called the Sciatica Protocol. If you don't have the time to see a professional, but are tired of trying to figure out this recovery on your own, then the Sciatica protocol is for you. Harness the power of a knowledgeable physical therapist through your phone. It takes no more than 7 minutes per day, and it is designed to help you recover as quickly as possible. It is simple to start, and all you need to do is log into ifixyoursciatica.com/the-sciatica-protocol and fill out the 9-question quiz to begin. The link for the program is in today's show notes. Yeah, it's very eye-opening. I actually had the opportunity to get trained in dry needling back in 2016 in New Jersey. And then, interestingly enough, the moment I got certified a few months later, dry needling was actually deemed not part of the physical therapist scope of practice in New Jersey. And so that lasted about, I think it was probably like 2 to 3 years. I think New Jersey just granted physical therapists to add that to their scope of practice. I think as of maybe 2021, which I think it's a fantastic modality. To boil it down, correct me if I'm wrong, but if we were to say, like, what is dry needling's brand line is that, and I wrote it here, but it was this aspect of the use of needles to stimulate a change in tissue. Would you agree with that? Like, what are your thoughts on that statement? Just so that I want to make sure I summed it up correctly.
Well, yeah, I mean, boiling it down to that, as long as cool. Tissue in this case could mean, all different types of tissue, and that would involve all the chemical processes with it as well, blood flow and stuff. Yeah. Then
awesome.
Yeah,
cool.
I would agree with that.
So let's talk a little bit more about the scientific back end of or the theories behind why dry needling is effective. You briefly talked about blood flow and the pain killing systems. Could you elaborate a little bit more on that?
Yeah, sure. There has been demonstrated vasodilation or the capillaries and such open up, and there's improved blood flow locally to an area that has the needle punctured in there, and that's one of the theories behind how it works. There's also many effects as far as different hormones and chemicals, so endorphins and opioids and body's enkephalin system that they get activated through different pathways, and it's very complex and a lot of it theoretical, really. Still, it's been tested in in a laboratory with rats, but not so much humans, just because of the issues you have with carrying out that sort of research. So there's those sorts of things. And then another effect, which the acupuncturists have been taking advantage of, and physical therapists less so, is the idea of needle rotation. So twisting the needle to elicit it's called mechanotransduction, where the tissues are actually winding around the needle, and through that you get further secretion of and activation of these pain-killing pathways, as well as remodeling of tissue. And so it can be very helpful too for, say, scar tissue problems that we want to try to help alleviate pain and or decrease some of those lumps and stuff that we get after surgeries and such due to all the scar tissue collagen lay down. You can help remodel tissue through that mechanism. So a whole host of things potentially going on with the effects of dry needling.
Yeah. So in essence, we have some mechanical changes. So what you're putting in can result in improved blood flow, which improved blood flow to any sort of area is actually going to help promote healing. But also in some cases, if an area is actually deprived of oxygen, it can actually not function very well. So that's where we're looking at making sure that there's enough oxygen, blood, nutrients in that air so it can function a little bit better. And then we have the chemical changes in which we're looking at the hormone release, the endorphins, opioids, and everything like that. And then the remodeling, I think that's huge. A lot of people look at this aspect of, say, scar tissue, and every practitioner has a opinion of their own when it comes to the use of, like, say, soft tissue work, like massage, and how that can break up scar tissue. It's and then also it's a little different when you're using dry needling, because you can actually go into the tissue itself and have that potential for remodeling. And so let's talk about the needle itself. It's a filament. It's very, very small. And when I was getting trained for dry needling, I thought it was really interesting, because they said that the needle itself, it wasn't like an IV where it would tear tissue. It would actually be the needle that would actually pass through the cell. So it's really more of kind of like a parting of the Red Sea versus like ripping open a tissue, which doesn't sound very pleasant. But there's a lot of different techniques that people can use. And you talked about this concept of mechanical transduction. When someone gets a dry needling treatment, is it is it where the practitioner puts the needle in and leaves it there and goes away? Tell us a little bit more about what that application technique is like, what the experience is like, what people can expect when it comes to needling.
Sure. Well, to go back to what we talked about before, there's a wide range of how people are trained in it. And so you'll have some practitioners, physical therapists, acupuncturists, where they won't really retain the needles in the patient once they're inserted. And then you'll have practitioners like me and most Chinese medicine practitioners, traditionally anyway, have put the needles in, wound them a little bit to elicit that winding response, and left them in for anywhere from 5 to 30 minutes. And there's a lot of randomized trials supporting that. So that's what I do, is I leave the needle in for at least 5 minutes. But some don't. They've been trained more in a trigger point pistoning sort of thing, where they put the needle in, insert it a few times up and down into where they believe a trigger point is located, try to create a muscle twitch response, and then they take them out. So you will get a wide range of how practitioners treat with needles, which is something that would be, which hopefully research is going to, going forward, kind of figure out and tamp down on some of that variability, because we'll hopefully learn what is a more optimal way to treat a patient. But to me, the randomized trials are pretty clear, and my clinical experience as well has been better for the idea that putting the needles in and leaving them for 5 to 10 minutes gets a better effect than just in and out sort of thing. So that's the way I do it. I do some trigger point pistoning as well. So for a patient coming in, they may have some discomfort with the needle insertion. Kind of depends on how sensitive they are to needles and such. But for the most part, most people say, "Oh, that wasn't as bad as I was expecting." They come in and some trepidation about needle insertion and getting injections. But like you said, the gauge of the needle is so small that that same sort of tearing and sensitivity of the needle insertion is pretty low to almost non-existent for some people. So
yeah, that makes a ton of sense. I mean, I look at it as and I think you proved a really great point, is based on the patient's presentation, you'll actually get to determine what is going to be the best option. Is it going to be leaving the needle in for a longer period of time, or is it going to be something like a pistoning? To me, it seems like when you're doing, say, a pistoning technique, the nervous system is a little less hyperactive. So that's where we can apply a little bit more of a stimulus that way. And it seems as if you leave a needle in, it's a little bit more gentle. So for someone whose nervous system or is a little bit more on edge, you create in a way, a safer space for these people to take the needles in. And I remember when I took my certification back in 2016, before we actually even put the needle in someone else, they actually instructed on how to put the needle in our own arm. And I was pretty trepidatious myself. And it was really exciting to be able to put the needle in and say, oh, it actually is not bad at all. Actually didn't feel like anything. Yeah. So that was a really, really exciting thing, and actually allowed me to to really implement and learn those skills together. And I find that there's a ton of value in what dry needling can provide. So let's talk about the value and how it actually applies to people and patients who are actually experiencing sciatica pain. So if you're working with someone who says, I've been having these radiating symptoms from the back down to my leg, what are some of the things that you would look for as a dry needling practitioner that would actually help you determine whether or not this person would be a candidate for dry needling?
Well, in general, I would say needling and, well, maybe lots of manual therapies work best when pain is a bit more localized, meaning that, there's kind of one spot where it hurts more. Now with sciatic pain, you don't necessarily get that, but what you can get is noticeable irritation. A lot of people have heard of the piriformis muscle. And so in that area where that sciatic nerve passes along, that area can be noticeably tender on folks. And when they have tenderness there that's easily distinguishable and pretty well localized, and that is coupled with sciatic pain, that would definitely be an indication to me that needling could be noticeably helpful here. Doesn't have to be necessarily that way. There's a lot of different presentations, as I'm sure you've gone over in your channel, of sciatica. You've got back pain with it or back pain without it. You got some people with sciatic pain just down the back of their thigh. Then you've got others with it radiating all the way down into their leg and foot. So you got kind of a lot of different presentations that can all kind of get bundled into the sciatica. But that would be, one certain indication of me wanting to put a needle in is if they've got that localized pain in the butt cheek area, and that's kind of part of their sciatic pain presentation. Like I said, doesn't have to be that, but yeah, that is definitely something I look for.
Okay, so yeah, we're looking at more we're looking at more localized areas, irritation of piriformis, even irritation of the spinal muscles. I remember when I was getting my certification years ago, we were talking about how can you actually address some of the paraspinals in which they could actually be either hyperactive or underactive, and being able to insert a needle into those paraspinals can actually lead to some really cool changes.
And that can all be part of it because, I'm a big fan of treating along the anatomical chain there. And so, paraspinals, the nerve roots that come out from the vertebrae and then join up to create the sciatic nerve. Getting stimulation through, the needles even, and can be definitely, additive to the benefits you want to put into maybe more localized where the pain is presenting for the patient, but you still may want to, treat above that sciatic nerve area to try to help along the chain to treat potentially the root cause of their symptoms. So, yeah,
that makes a ton of sense. And so, piggybacking off of that, let's talk a little bit more about what people can expect from a session working with a practitioner using dry needling. Is it where they come in and they're like, oh, I have this pain here, and then the practitioner comes in and just puts the needle in and it's like, okay, you're fix and go? Or is tell us a little bit more about like what are the things leading up to the actual like inserting of the needle, and then once you insert the needle and you establish a change, what are some things that you actually tell your patients to do to ensure that those changes last between sessions?
So I believe what should kind of occur is a good explanation, first of all, of what they could potentially feel. For me, I'm big into disclosure on those things and telling them, the good and the potential mild side effects. I mean, and then of course you discuss the other things as well as far as the mechanisms and stuff. But so once you've done that and you've established kind of what's driving their pain, if you believe it's from the spine or more localized into that piriformis area, or kind of all the way from the spine down to the lower part of the leg through different tests, like different tests that physical therapists perform to try to see, is it the nerve roots, is it the spinal joints, is it more localized? So once you've got a good framework for where you think, you know, the pain is presenting through and what anatomical structures are the most sensitized, then as far as the insertion itself, I believe it's best to, the first session at least, if not the first couple of sessions, to dose them up. I talk about it in terms of, like we think of medication. When a physician gives patients medication, they don't generally just wham them with the full dose right away. They build them up to build some tolerance, get the body used to it. And I think the same should apply to needling. And so I believe the first session should be putting the needles in to the target area, or at least superficially in the target area, with just 2 or 3 needles. That's what I believe is best, because I, you know, it's probably over 100 times now where I've been practicing and somebody's had dry needling before, and they said, "Oh, I went for that," or "My friend went for that, and it was so miserable the first time. They put these needles in, and I was sore for I was worse for 2 weeks, 3 weeks, and I never want to do that again. Or because of my friend, I'm even scared to try it." And there's been many times where I've told people, "Okay, well, can we try it? Perhaps the methods that I use. I'm only going to put in a couple needles, try that." Every time that's occurred, I can't say I've cured everybody in those circumstances of their pain, but I have not caused that huge those huge side effects of soreness and worsening pain. And sometimes, and many times I've been able to help people, and help people and every time I've been able to help people to not be so scared of dry needling, because they thought, "Oh, this is what dry needling is. I go in and I'm miserable and it just doesn't work for me." Well, I think of it now as more of they got overdosed that first session. You know, somebody went in, they took a weekend course, and I'm guilty of this too. Take a weekend course, you get told, "Okay, you put it in here, 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 here," wherever they have pain, and stab it a bunch in there, piston, and then your patient comes back, and you know, some patients love that, even the first go around, but some are just miserably sore. I think it's best to start with a few needles, see how their body takes to it, and then to build them up where you're using more needles and getting in there deeper. But at least that first session, I think, is crucial to see where the body is as far as its tolerance to needles, and that way you don't send them, you know, running for the hills and never wanting to come back to your clinic again. So 2 or 3 needles without a lot of pistoning, I think, is the wisest course of action, and then to build it up from there. That way they don't have a bad effect the first time. You let them know also, okay, this first time may not hit that home run for you right away. You know, it may not help at all, but we can always add some more needles next time, increase your dosage, and people tend to respond really well to that idea, because a lot of them have been taking medication or have taken medication before and can kind of understand that rationale of, okay, I'm going to build up the needles. We're not going to just, you know, throw the full dose at them. And so the second part of what you'd asked, remind me what that was. There was another piece of that you asked, not just what they experienced, but
before we get into the second part, I actually really appreciate what you're talking about, because it's so easy for people to get really excited and do a ton of stuff. And this is going to be for every practitioner and also every patient who feels good upon leaving a session, right? They're going to be really excited and they're going to overdo it. And then they're going to be like, "Holy moly, either this didn't work for me at all, or I probably did a little bit more." So I do appreciate you being able to say, let's start low and slow. and then really just establishing those expectations. And that's going to be important across not just dry needling, but for anything at all, being able to have that communication and understanding of expectations. The second part of the question, Dr. Buck, was, okay, people, most of the time people are coming in for a little bit longer. So, okay, they come in, they get their needle technique, right? What happens after that? Do you tell them to just go home and live on their lives? Do you end up enforcing exercise? Tell us a little bit more about that.
Yeah, well, I prefer personally to, if you're in a clinic that is doing a multimodal approach, which is great, I prefer to do the exercise components first, if you can, and do the dry needling at the end. That isn't always feasible, and that's fine. You can do it in any order, but I prefer to do the needling at the end. What I tell patients is, if you are sore later, use some heat on there to try to help with that. Certainly they could use ice and anti-inflammatories, but what I tell them is, we're trying to cause an inflammatory response here to kickstart things, to reset these processes, to get the body to heal a little bit better. And so you're going to fight against that a little bit if you're using ice or anti-inflammatory. So I tell them, if you don't need to do anything, don't do anything. But if you're going to use anything to try to help with any soreness, I would use some heat. Generally, with that approach, 2 or 3 needles tends to go really well for almost everybody. And so they don't even need anything. And, and some people get great results even from just 2 or 3 needles on the first visit. Other things, I have seen literature regarding the idea of trying to have people cut back for a time, 2 or 3 weeks, on whatever activity seems to really flare up their symptoms, if that's possible. That's not always feasible. People work, people have, busy lives, and so you can't necessarily have them just shut it all down for 2 or 3 weeks. But there is a place in that I've seen in the literature for that idea of treating them once or twice a week for 2 or 3 weeks, and taking away the painful stimuli that are happening, whether it's an athlete with sports or at work, if there's some sort of modified schedule they can do. But it isn't always feasible, of course. But yeah, I think it's best at that needle visit for 24 hours. I think it's wise to take it relatively easy if they can. So at least that 24 hours after getting that needle treatment, I do think it's wise to have them try to cut back, use some heat if needed. But generally things go pretty well. So yeah, that's what I would say.
Yeah, that makes sense. Yeah, and I actually do appreciate you talk about this, the use of exercise or even therapeutic exercise, being able to do it before, because in some cases, yeah, you're creating an actual change, whether it be an inflammatory response or a neurological response. We want to be able to make sure that we're able to maintain those changes, but also ensure that we're not overwhelming the system, which is why after your techniques, we want to be able to give it an opportunity to recover, but also if we are allowing an inflammatory response to facilitate healing, we need to make sure that we let those natural processes go through. So I really appreciate that, Dr. Buck. And so you're having this, and I mean, you're painting us a really vivid picture of what to expect when it comes to what a dry needling experience is. And you were talking really a large part about the fact that it is a tool. And so you use your clinical decision making to be able to determine, okay, is this person a candidate or not? And then also here is the designated plan. So dry needling itself can help a lot of people, but let's talk about the folks who might not necessarily be the greatest candidates for dry needling. Who wouldn't benefit from dry needling just based on your experience and what you've seen?
The people that have, I would say, more struggles with it are people that just struggle with needles in general. I mean, having that if somebody has a real severe phobia to needling, or even, quite a bit of trepidation about needles, statistically, proportionally, they might not do as well. But I try to utilize it on anybody. I don't want to take a treatment away from somebody that could potentially still benefit from it. So that would be one thing that to consider, or at least even do less of how much you would needle, one needle maybe the first time. And, and then you've got different things that you'd want to be extra careful about if people have metal allergies, if they've got hardware in a certain area that you're going to try to needle into, you could get infected, whether it be knee replacement or, for sciatic pain, potentially putting it into the lower back if they've had lower back fusion. All these things aren't necessarily, can't do type things. If they've got blood clotting issues, they're on blood thinners. Those are, precautions, I would say, but still not something that necessarily you can't, absolutely can't do on those people. You just want to be even more cautious than you would otherwise be. But yeah, I've done it on lots of people with lots of these precautions and been able to help them over the years. So I kind of live by the idea of I don't want to deny somebody something that could be potentially beneficial. But yeah, if they're afraid of needles, they got blood clotting issues, frail skin, potential for infection, pregnant, those things are things where you'd want to have a good rapport with your patient and discuss with them the potential pros and cons, and then kind of let them decide as well. It always should be kind of present them with what you think and then let them decide what they want to do.
Yeah, definitely makes sense. Not only are you educating the client, but also having these key considerations to make sure that you're implementing this tool safely. I'm glad that you do that, and every other practitioner should be doing as well. So let's talk about other practitioners. Right now, you are located out in Colorado, right? And so you have your local clinic. I would love to talk a little bit more about your local clinic as well. But the folks who might not necessarily be able to have access or even go out to Colorado to see you, what are some of the qualities what are some of the qualities that people should look for in a practitioner, and what is an easy way for someone to find a dry needling practitioner who can possibly help them?
Well, dry needling really has kind of taken physical therapy, orthopedic physical therapy by storm in the last 5 years. So lots of clinics are doing it. I think the best way to find somebody that is more familiar with it is to call up a physical therapy practice and try to get an idea of when they took their training, how often they use it, and kind of what their treatment approach is. I think somebody should be able to give people, easy answers on how they go about treating with needles. Sometimes that's not always easy to get when you're calling a receptionist and stuff. They don't really know necessarily. So that's kind of tough when it comes to, the actual practical application of that idea. But that's what I would do if I was coming, and that's what I do when I seek healthcare from other healthcare providers. Is I call up, or I'm looking at their credentials that they have published on their website of, when they did certain training and how often they use it. And if I'm not satisfied from just looking at a website, I will call and I'll request to. I think it's a very reasonable thing for people to expect people to talk about their experience and how often they use it and stuff. And so that would be, I think, the best way to go about finding a practitioner to help you out with that. If they have specialty designations in manual therapy, if they're a fellow of the orthopedic, of the American Academy of Orthopedic Manipulative Manual Physical Therapists, AAOMPT, that's certainly an additional benefit because they'll be able to couple that with other manual therapies like spinal manipulation that could be really helpful for sciatica pain. But yeah, that's how I would go about finding somebody to do dry needling approach. And if because if they've only barely taken their training a little while ago, they aren't really sure. They haven't really gotten their feet wet just yet, and so that's what I'd want to know. At the same time, you wouldn't want to necessarily, if you can get a hold of a practitioner of any kind, and it seems like they're rooted in one way of treating and aren't trying to be patient to patient adaptable. I would say, that also wouldn't be something that I would steer towards myself. I like people that realize that there's more to learn, and there's always more and better answers out there. And so I want providers that, have good training, have good background, but aren't so sure of themselves that I think that they've just lost the ability to continue to learn.
Yeah. So we're looking at, when you're out there searching for a provider near you, we're looking at proper credentials. And if you have questions, give them a call and they should be able to answer, even if they have a front desk person who can answer some of these questions for you. Maybe not necessarily a clinical answer.
That would be how I would go about it as a patient. Just look at the website, see what they have to offer. Okay. If that passes your test, or if it doesn't quite, I would still give them a call and just ask what they're used to, how often they use it, maybe even knowing how. It takes time to offer a good manual therapy / dry needling treatment too. So if they see patients every 15 minutes in their clinic, coming in the door over and over again, that may not be somebody to go to dry needling to get dry needling from, because chances are they've only got 5 to 10 minutes to actually do the needles on you. But yeah, if they've got some more time between patients coming in, 30 to 45 minutes, that would also be something I would want as a practitioner as well as a patient. So is that time to be able to work one-on-one with you. Otherwise, you're just going to get kind of a pretty canned treatment.
Yeah. And in addition to that, having a therapist or a provider who's actually open to trying out various different things, you're absolutely right. When someone says, I have a hammer and everything is a nail, and you're presented with something that isn't requiring a hammer, it could be a waste of time, but also can put you in, make you not feel the best. And so, it seems like you're approaching all this stuff with an open mind. You have a clinic of your own out in Colorado. So can you tell us a little bit more about your clinic? And for anyone who is either in the Colorado area or wants to reach out to you, what's the best way?
Yeah. So the best way would be to reach out to me through my email or phone is fine too. My email is IMMT 5280. So IMMT 5280. That's for the Colorado Mile High Denver thing. So IMMT 5280 at gmail.com, or my phone number is 303-918-6162. I teach classes on this stuff, manual therapy, spinal manipulation, dry needling as well. But then, during the week, I also I practice part-time to help out the community. So, and taking new patients. So would love to help people out that hear this podcast or in the area. Like to come out and give it a try.
Beautiful, Dr. Buck. Thank you so much for your time today. I know that we've been trying to go back and forth and trying to get this episode up and running. It was a long time coming. I'm so thankful again for you sharing your knowledge. And for listeners, if you didn't get a chance to actually write down his contact information, I'm actually going to be putting it in the show notes. So again, Dr. Buck, thank you so much for your time today.
Thank you. Appreciate it, Dr. Buck.
Thank you so much for tuning in. We hope you got some help from today's podcast. And for more info, check us out at ifixyoursciatica.com. Have a fantastic and pain-free day. No patient-therapist relationship is formed by listening to this podcast. We are not providing medical advice, and all information should be confirmed by a medical provider.